Hi friends, Dr. Ramadevi Papalu here, a fertility specialist. Today I am going to discuss in detail about IVF. IVF is nothing but collecting the eggs outside the body and mixing with the sperm in the lab after fertilization and embryo formation, putting back the embryo into the womb of the lady. It is as simple as that. Naturally, fertilization takes place in the fallopian tube. Here, fertilization takes place in the petri dish. Naturally, the embryo grows in the tube for 5 to 6 days. Instead of in the fallopian tube, the embryo grows 5 to 6 days in the lab. Afterwards, either it is in the natural pregnancy or in the IVF, the embryo has to reach the womb. So, this is a very simple procedure and very effective procedure. Even in naturally, when you want to conceive, soon after marriage, even if they do not follow any family planning method, everyone will not conceive in 1 month, depending upon their fertility rate, both wife and husband put together. We classify them into high fertile, medium fertile and low fertile. High fertile are those who conceive within 6 months of marital life, medium within 2 years of their marital life, low if they take more than 2 years. So, even in the natural course, people will not conceive very fast. Whereas in IVF, in one cycle, with the latest technology, we can expect 60%, in sometimes even 70%. So, IVF is a very effective mode of getting pregnancy, those who are suffering infertility. So, let us go into the details how IVF is done. Step by step I will explain to you. Step 1. In step 1, both wife and husband are evaluated physically, mentally and reproductive system. So, physically, because we have to evaluate if they are overweight, if they do not do exercise, if they do not eat well, all those things they have to correct. And when come to the general health problems, if there is any already pre-existing conditions like diabetes, hypertension, thyroid, hyperprolactinemia, any of such conditions, we have to investigate first and correct them before going for the IVF treatment. Simultaneously, they must take nutritious diet, they must take vitamin supplements to get the best results, and they should calm their psyche, because stress itself is one of the important reason for infertility. So, they must train their brain to become very peaceful, calm, cool, happy-go-lucky type. If you prepare yourself like this, your success will be very high. So, both wife and husband, if at all, if they are too stressful, their psychology, they can even go for the hypnotherapy or counseling. So, or sometimes even we advise acupuncture. If they are psychologically cool, their success will be doubled. So, coming to the reproductive system, for a female, basically we have to see what is the position of the uterus, what is the position of the ovary. Ovary is to produce the egg, uterus is to carry the baby. So, let us take details about the ovary. Ovary, by doing scanning on 3rd day of period, we can count the number of primordial follicles, future eggs. So, normally if there are at least 5, 6 on either side of the ovary, that is sufficient to become a successful pregnancy in IVF. And baseline FSH, follicle stimulating hormone. This is the 3rd day, whatever follicles we have seen, by giving this hormone, all those follicles increase their size and come to the maturity. And LH is the hormone. When follicle is matured, reaches 17 to 20 millimeters, this LH hormone matures the final maturity of the cytoplasm and nucleus. So, these two hormone levels are very important, one for the stimulation, another for the luteinization. and afterwards even the ovarian reserve, because the hormone AMH is secreted within the ovary depending upon the number of the follicles. So, if it is medium or above average, the number of follicles we get better. But if AMH is less than 1, then some people may not be able to get sufficient number of eggs. Very rarely even inhibin hormone is also related to the ovarian reserve. Sometimes we advise inhibin B. Normally FSH and LH, FSH should be 2 and LH should be 1 ratio, 2:1 ratio. In case if LH is more, then we will give medicine to reduce the LH to normal level below 5. So, for that we can give oral pills or progesterone. Next, we also call on the 18th day of the period to study the uterus, uterine receptivity. So, uterine receptivity, there are various molecular aspects as well as the anatomical structural aspects. On 18th day of the period, one simple color Doppler test gives us lot of information. And uterus has got two layers, inner endometrium, outer myometrium, or covering peritoneum will be there. So, in the myometrium, motility, peristalsis, blood circulation, if there are any fibroids, adenomyosis, they have to be identified. When coming to the endometrium length, thickness, layering, blood flow and movement. These factors are very important. And uterine artery PI is also recorded. When we do all these biophysical parameters, if the score is 14 and above out of 20, the receptivity will be better. In case if the score is less, before starting the IVF, we have to give medicines, improve the biophysical profile, then the success rate will be more. And there usually, because these infertility patients will be undergoing some procedure or the other procedure. So, there is every possibility of mild infection in the uterus. So, to correct the mild infection, we can even do the CRP. If the CRP is raised, natural bacteria which are present in the vagina and bladder, urinary tract and genital system, we can replace them, because if there is a disturbance in the bacteria, positive bacteria, that also will affect the results. So, we will supplement the natural bacteria into the genital system as well as the urinary tract. Any infections we have to clear. And supplements like vitamin D, vitamin E, B12, B6 and CoQ. Sometimes to increase the blood flow, the L-arginine as a powder we can give. So, all these supportive medicines will improve the quality, magnesium, selenium, useful minerals also, it is very important in the reproductive procedure. So, before proceeding for the IVF, we have to evaluate thoroughly to improve the results. So, previously repeatedly number of cycles, if there is a failure, repeatedly people used to do number of cycles. So, instead of doing repeated cycles, if you take care of all these factors, failures are very less. Because if you do not take care of these factors, failure become very common. So, do not take risk, get evaluated, do all your best from your side, then start your treatment. Similarly, even the man mainly problem is most of the people may drink, may be smoking. So, both of them are harmful for reproduction. So, suppose if they are doing, they must try to avoid all those things. And again stress, because most of the men are doing stressful job and night duties, they also have to take care of these two factors, stress factors. And also importance for the timely taking nutritious food, if possible organically grown vegetables and non-vegetarian also, So, because in the normal vegetables, lot of pesticides will be there. So, they are also harmful, they also affect the quality of the sperm because they produce more number of oxidants in the body. So, high level of oxidants, and the food what we are taking, if it is acidic food, these two things, presence of lot of ROS, reactive oxygen species, and acidic body, these two will affect the quality of the sperm. We have to take care of these factors, take antioxidant diet as well as the supplements, and drink alkaline water, mineral rich water, and water which has got antioxidants. So, by taking all these precautions, why I am telling, insisting all these things is to get the pregnancy within the first cycle. So, if you want to get pregnant within the first cycle, you have to watch all these things, take care, and contribute. Not only the doctor responsibility, it is the responsibility of the both wife and husband. If they also participate actively by taking all these precautions what I have told, your success rate will be better. So, once the evaluation is over, next step is starting the medicines. Starting the medicines for the female, mainly for the female, because we have to produce multiple eggs. Like in the nature, when we want to grow, suppose you chicks, 10 chicks, 10 chickens you want to grow, you will put 12 or 15 eggs, so that some will go waste. Similarly, even in the human being, we need little more than what we need exactly. So, for this, protocols will be commonly, very commonly used protocols are long protocol, antagonistic protocol, minimally stimulated natural cycle protocol. So, in long protocol, gonadotrophin releasing hormone agonist injection is given on 21st day of previous cycle. So, with this what happens, this hormone acts on the pituitary and depletes all the source of LH and FSH, and by the time patient gets the period third day, FSH LH will be low. So, body comes under the control of the doctor. So, what is the advantages with this protocol is premature luteinization of the follicle will not be there. That means premature release of the LH hormone before the follicle reaches 17-18 millimeters. If LH is released, that is called premature luteinization of the follicle. With this, egg quality, embryo quality, and pregnancy rate are all affected. So, this can be prevented perfectly with GnRHA long down regulation protocol. But with this protocol, the dose what we need to give may be more, and hyperstimulation, especially hyperstimulation syndrome. IVF means in the olden days we used to get scared of hyperstimulation, but thank God lot of research has been done how to prevent the hyperstimulation syndrome. Nowadays we are not seeing hyperstimulation syndrome at all, but with long protocol, when compared to the antagonistic protocol, OHSS is quite common. But implantation rate and implantation window, that means when we put the embryo inside the uterus, if the window is open little longer, the implantation will be better. So, in long protocol, a uniform cohort of the follicles is possible, because on third day, if all the follicles measure between 4 to 6, by the time all the follicles mature, we get more number of M2 oocytes. So, this gives best embryos. This is one advantage. Premature luteinization will not be there, second advantage. Implantation window will be wider, third advantage, and good quality embryos also we get. So, coming to the next antagonistic protocol, here if the LH is high in the previous cycle, we can prescribe oral pills or progesterone. We try to bring the LH on third day of the period below 5. So, once this is below 5, we start stimulation from second or third day of the periods, because internal contribution of the LH is there already in the body. We did not suppress with the GnRHA. We need not give HMG injection. we can start with pure FSH injections. So 5 days we give these injections, and 6th day onwards we call the patient for the follicular study. So from this day onwards, every day patient has to come. At least 1 to 2 millimeter per day growth of the follicle should be there with the medicine. Suppose if the growth is not sufficient, we have to increase the dose. If the follicles are growing faster, we have to reduce the dose. And depending upon the total number of the follicles and the size of the follicles, we need to do serum estrogen level, because serum estrogen is very important to estimate whether this patient is going for hyperstimulation or not. So, in the antagonistic protocol, we repeatedly need to do LH, because if the LH goes above 7, 8, the problem of premature luteinization, quality of the egg will be affected. So, some people give antagonist blindly from 8th day onwards or 10th day onwards. But if the LH is release is high, this 1 ampule giving blindly will not be sufficient. If there is only 2-3 units of raise, maximum 5 units of raise, 1 ampule of antagonist will work. But if it is more than that, we need to give 2 ampules also. That is why I prefer to do LH blood test instead of giving blindly to get the better results. So, LH E2 we will be giving. Suppose if we want to do the embryo transfer in the same cycle, then on and half we have to do serum progesterone also. So, before the pickup of the oocyte, if the progesterone is increased, then the implantation rate will be less because of the premature secretory phase. If we are not planning for embryo transfer in the same cycle, we need not do progesterone. If we are going for the all freeze cycle, all freeze cycle means whatever the embryos are there, instead of transferring 100% we freeze and plan in the next cycle, so that all these discrepancies like a progesterone or high estrogen or all these things will not be there. Controlledly we can prepare the endometrium for the better receptivity of the embryos. So, this is the stimulation protocol step 2. Once the follicle reaches 17 to 20 millimeters, in the step 3 HCG injection is given or LH injection is given. Sometimes we even give combined injections for the better results. So, once we give this, the retrieval time will be fixed between 34 to 36 hours after the HCG injection. So, once that is the oocyte pickup is the step 4. In the step 4, after the oocyte pickup, we do under mild anesthesia, IV anesthesia. Patient need to come at least 6 hours of fasting, and post procedure within 4 to 6 hours you can go home. But because of the stimulation, ovaries will be in a bigger size. So, in some rare cases there is a possibility of twisted ovarian problem. So, ovary gets twisted. So, suddenly patient will get the pain. So, we have to instruct about 2 things after the oocyte pickup. 1, caution about the twisted ovarian. 2, caution about the hyperstimulation. If in both the cases patient will get pain, but pain is a different pattern. If it is a twisted ovarian, usually when the patient goes to the toilet, when the bowel movement takes place, the ovary on the bowel get twisted. So, sudden pain patient will get when they are going when they had been to toilet, and again it will subside. Again twist can be to once, twice, thrice like that. So, with every bowel movement sometimes the ovary can get twisted. So, again that pain will subside little, but once they go for the toilet it can appear again, but this pain is very excruciating pain, intolerable pain. Because of the pain, the lady may have vomiting sensation, giddiness. So, if it is a hyperstimulation pain, it is because of the overstretching of the ovaries. So, that in that pain there will be vague dull ache all over the abdomen, especially in the lower abdomen. So, Along with this, in the hyperstimulation, patient may have dyspnea, bloating, discomfort in the abdomen, and uh, pain. So, with these symptoms, we have to identify whether the person is having a twisted ovarian or hyperstimulation. So, whatever it is, while discharging the patient after oocyte pickup, we need to instruct them about these problems. If everything goes well, we before going for IVF only, we will be discussing what we are going to do with the embryos. Are we going to transfer in the same cycle or in the next cycle? Or part of the embryos we are going to transfer and part of them are we are going to freeze. So, that also we have to discuss. So, the number of embryos will be decided depending upon the patient age and the quality of the embryos, and whether they want a single baby or twins, and which day of the embryo we are transferring, third day or fifth day. So, all these factors keeping in mind, doctor will discuss with the patient and decide and call them back for the further procedure. So, either third day or fifth day or next cycle. So, all these things crystal clearly we have to discuss with the patient. Patient should understand pros and cons, so that there will not be any misunderstanding between the clinic and the patient. So, embryo transfer is the last step, and afterwards follow up. Follow up till 12 days we have to give the progesterone support, and call the patient on 12th day if the embryo transfer is on 3rd day, and do the first time beta HCG to confirm the pregnancy. If the beta HCG above 50, we will continue the medicines and ask the patient to come on 21st day. If the beta HCG is less than 2, that means the case is failure. So, for them the medicines we can stop. The medicines mainly is the progesterone hormone. Progesterone hormone is given either vaginal pessary cream, oral capsules or injectables. So, that also doctor has to discuss with the patient. We have to find out their compliance, their likes, dislikes, and what they prefer. But we have to maintain the serum progesterone at least 9 to 10. Then only the endometrium will be maintained, pregnancy will continue. So, to maintain that, whichever route is, sometimes we even combine. We do not leave with one route of progesterone administration. And finally, confirmation of the pregnancy with the scanning is done 30 days after the embryo transfer. By this time, actually it is 6 weeks pregnancy. 6 weeks pregnancy will show gestational sac, fetal pole, fetal heart. If we see all these things, then we confirm the pregnancy and continue till delivery. So, these are the steps in IVF. So, if you know all the details, when you come to the doctor, you have any doubts, you can ask the doctor or you can ask the counselor, and it becomes easy for you to go through this IVF procedure. It is, once if you know, it is not at all a stressful procedure, it is not at all a difficult procedure and painful procedure. With the knowledge, you will have less stress, so your results will be doubled. Okay, now, thank you. If you have still doubts, please write in the comment section. I will answer them.